This is Dr. Charles Denham. Our rapid response team with the MedTech Bystander Rescue Care Program is producing a series of videos, webinars, and presentations to deal with the coronavirus crisis. This Scrubs clip shows how a person can be a carrier who is not infected and can unknowingly pass the virus on to others. We use something called glow germ or glow gel in a similar way to teach infection prevention in hospitals. The science regarding coronavirus is evolving daily, so no matter what we say in this film, follow the latest guidance of your professional caregivers who care for you and your family. The press reported results of an article to be published in the Journal of Emerging Infectious Diseases. It addresses the spread from one restaurant patron with no symptoms to 9 others seated in the same room. Identification and contact tracing is said to have verified that the infections occurred from this exposure. The person marked A1 infected the others in the red circles. Note the location of the air conditioning vents and airflow. It is presumed that the restaurant's air conditioners blew the virus particles around the dining room. The New England Journal of Medicine article described earlier not only addressed that the viable virus may linger in the air for 3 hours as aerosols, it also showed that the coronavirus may remain on what we call high contact surfaces. There are additional articles such as in the Lancet Microbe Journal that added to the contact surface information, and there will be more that will come along. When these two articles are integrated into a common chart, as some in the press have done, the pattern looks like this. The virus was found on paper and tissue for 3 hours. Keep this in mind as you care for someone else. The virus can remain on tissues used by someone who's infected, whether they're symptomatic or asymptomatic. On cardboard for 24 hours or a day. This is important as you bring groceries or packages into your home. Experts recommend to let them sit for more than a day if you're not going to disinfect them. On wood and cloth for 2 days. This is important if you're reusing cloth masks or have to be in a contaminated area. If you can't wash them, store them in a safe place to let the virus die. This is what caregivers do if they do not have enough disposable masks or they have to reuse them, which we will show you later in our film. Stainless steel for 2 to 3 days. This is important to us, especially as social restrictions are relaxed and populations get back to work. High contact surfaces like railings pose significant danger for transmission. They are one of the most common contact surfaces that can be contaminated in public places. Polypropylene plastic for 3 days. Non-porous surfaces like plastic and even plastic bags allow the virus to be viable for a longer time than on paper. This is why counters and table surfaces must be disinfected frequently. And glass and paper money for 4 days. Again, glass is a non-porous surface and can retain viruses for some time. And paper money has long been known to be a source of spreading germs. This is why electronic payment systems are very helpful now. The virus was found on the outside surface of a surgical mask for 7 days. We've posted these articles on our website so that you can review them. This was an interesting finding. Therefore, later in our program, we will provide some ways of taking great care with the use of masks, such as rotating them over multiple days. We will also show you how doctors use Tupperware bowls to take them off safely. A report by the CDC that virus RNA was found on the surfaces in a cruise ship 17 days after the occupants left has caused significant media attention. They found pieces of the virus, but did not report that there was viable virus that could infect another person. A study undertaken in Japan simulated the processes of group dining using the same type of germ glow material we use in hospitals to train caregivers regarding infections and their spread.
Common sight on cruise ships, resorts and casinos. Piles of hot food in communal trays, each patron helping themselves to as many servings as desired. If just one is infected, it may be the perfect setting for a virus to flourish. And a new video out of Japan helps show how fast it could spread. Medical experts teamed up with the country's public broadcaster, NHK, in an experiment that simulates a cruise ship's buffet-style restaurant. First, one of 10 participants rubs his palms with special liquid only visible under black light. He represents an infected person who had coughed into his hands. Then he joins 9 others as they spoon food onto their plates and sit down to eat. After 30 minutes, the room goes dark. Before an ultraviolet light comes on, the fluorescent liquid is now visible on a lot of surfaces. Items the so-called infected person had touched. Tongs, pitchers, food tray lids. Left residue others picked up. And in turn spread to silverware, dishes, glassware, clothing and phones. After half an hour, every participant had come into contact with the liquid. 3 of them had gotten it on their faces, a visual show of how easily a contaminated substance can travel. Video of the experiment has been viewed millions of times since it was posted by NHK. The Joint Project Supervisor says it's partly meant to illustrate how often some surfaces are touched by many people, like handrails, light switches or door handle. NHK and its collaborators did a second, cleaner version of the experiment, using hygiene changes like separating dishes, replacing tongs frequently, and asking participants to wash their hands during and after the meal. 30 minutes into that experiment, no one had picked up the fluorescent paint.
The bad news from this experiment is how easy we can transmit the virus through groups. The good news is that best practices really work. There is additional good news regarding the viability of the virus when it's outside in the sun. Sunlight, temperature, and humidity can shorten the time the virus is viable, according to the Department of Homeland Security. All 3 factors can speed up how fast the virus is destroyed. Regardless of the time a virus remains on any surface, it's key that we disinfect surfaces carefully. Now that we know that we can be infected through our eyes, nose, and mouth, through the air and contact surfaces, the guideline to make sure that we do not touch our faces makes so much more sense. Touching our faces is hardwired in our DNA. We know this because humans in utero touch their faces. Every time you tell yourself not to touch your face, you're doing something entirely unnatural. Studies show that we unconsciously touch our faces more than 20 times per hour. It's a natural process and can even be more frequent when we're under stress. The care of our communities is absolutely critical. Thank you for all you're doing to protect those at risk and those who are most vulnerable. As we say to all of our MedTech bystander rescue care teams, we have to fight the good fight, finish the race, and keep the faith. Everyone is a patient and everyone can be a caregiver.